Urea. Murex purpurea, commonly known as purple fish, is a renowned homeopathic remedy derived from a marine gastropod. Historically prized for its production of Tyrian purple dye, this remedy is especially effective in treating gynecological issues, including uterine prolapse, irregular menstruation, and heightened sexual desire. Murex purpurea is particularly suited for nervous, lively, and affectionate women experiencing weakness, anxiety, and sadness. This remedy also addresses frequent nighttime urination and intense hunger, offering comprehensive relief for various physical and emotional symptoms. It is famous for producing a purple dye, Tyrian purple, which was highly prized in ancient times. Historical facts. The dye extracted from murex was used by ancient civilizations, particularly the Phoenicians, who developed a complex method for extracting the purple dye. The color was reserved for royalty and high-status individuals due to its rarity and the labor-intensive process of extraction. Murex purpurea acts primarily on the female reproductive system and the mind. It is especially suited for nervous, lively, affectionate women who feel weak and run down. The remedy addresses symptoms related to anxiety, sadness, and various gynecological issues, including prolapse, dysmenorrhea, and sexual excitement. Health conditions. Key characteristics. Mind. Great sadness, anxiety, and dread. Stomach. Sinking, all-gone sensation, intense hunger requiring frequent eating. Female reproductive system. Various symptoms, including heightened sexual desire, uterine prolapse, and irregular, profuse menstruation. Urinary system. Frequent nighttime urination with a smell resembling valerian, constant urge to urinate. Mind. Great sadness and anxiety. The patient experiences profound feelings of sadness and worry, often without a clear cause. Dread. A persistent sense of impending doom or fear that something terrible is going to happen. Flora and fauna. Stomach. Sinking sensation. The patient feels a persistent, uncomfortable sensation of emptiness or hollowness in the stomach. Intense hunger. A strong, uncontrollable need to eat frequently to alleviate the empty feeling. Female reproductive system. Conscious of a womb. The patient is acutely aware of the presence of her uterus, often feeling a pulsation in the neck of the womb. Easily excited desire. Sexual desire is heightened and easily triggered. Pressing sensation. A feeling as if something is pressing on a sore spot in the pelvis, worsening when sitting. Pain. Pain radiates from the right side of the womb to the breasts, indicating potential nymphomania or excessive sexual desire. Sore uterus. Painful sensation in the uterus. Irregular menses. Menstrual periods are irregular, often profuse, frequent, and accompanied by large clots. Prolapse and enlargement. The uterus may prolapse or enlarge, causing pelvic tenesmus, a feeling of needing to pass stool, and sharp pains extending towards the breasts, aggravated by lying down. Dysmenorrhea and endometritis. Painful menstruation and chronic inflammation of the endometrium with uterine displacement. Leg crossing. The patient feels a need to keep her legs tightly crossed due to discomfort. Leukorrhea. Vaginal discharge, which may be green or bloody, alternating with mental symptoms and sacral pain. Breast tumors. Benign tumors in the breasts, with pain occurring during the menstrual period. Urinary system. Frequent urination. Increased frequency of urination at night, with urine that smells like valerian. Constant urge. Persistent feeling of needing to urinate. Modalities. Worse. Symptoms worsen with the least touch. Relationship with other drugs. Compare with health. Platinum, plat, known for addressing similar gynecological symptoms. Lilium tigrinum, lil, similar issues related to the female reproductive system. Sepia. Effective for gynecological problems but lacks the heightened sexual desire characteristic of murex. Dose. Potency. Typically administered in the 3rd to 30th potency. Administration. Dosage and frequency should be determined by a qualified homeopathic practitioner based on individual symptoms and response.